Hey everybody, Dr. Kumar here. Did I ever tell you about the time I almost got cold cocked in the ICU right after I had just saved a young woman's life? The story goes like this. I was delivering one of my patients up to the ICU. I had just removed a brain tumor from his head, and the ICU doctor comes running up to me and says, "Hey, Dr. Kumar, I need your help." So I follow her into a room, and there's a young woman laid out on a bed, and she's just moaning. I examine her, and she's deteriorated neurologically. There's something really wrong with her. So I take a look at her CT scan, and she has a shunt that was placed when she was a young kid for hydrocephalus, and the shunt has blocked up. And now the ventricles in her brain are blowing up like water balloons, and they're crushing her brain. So I tell the nurses, quick, run and get me an EVD and a cranial access kit. I need to slide a tube into this girl's brain and relieve the pressure, or she'll die likely within minutes. So they run and get me this kit. I shave her head. I drill a hole right through the right front of her head, and I'm getting ready to slide this tube into her brain when the nurse says, "Hey, she's become unresponsive," and the ICU doctor's like, "Quick, bag her." So they put a mask on her face and start blowing air into her lungs, and they're getting ready to get her intubated, which is a breathing tube. Well, I'm thinking I got to get this tube in because she's going downhill. She's in a deep coma now, and if I don't relieve the pressure, she's not going to make it. So I slide the tube into her brain, and nothing. It's dry, and I think, oh no, I missed the ventricle. So I pull it back, and this is a blind procedure. You have to use skull landmarks and triangulation to put the tip of the tube where you think the ventricle will be. And so I do it again using all this experience I have, and again, it's dry. And I'm thinking, oh no, this girl is rapidly collapsing neurologically, and I can't relieve the pressure in her head. Just then, I hear her heart rate monitor go beep, 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 beep. That's her heart rate is slowing because the pressure in her head is essentially slowing down her heart and is going to stop her heart. And so the whole room explodes into commotion. They're about to code this girl because she's going to have a heart attack because of the pressure in her brain. So again, I steady my nerves and I aim a little bit more medially and a little bit more posteriorly. I pass the tube and CSF just comes spraying out. I'm like, thank God. So I relieve the pressure and pinch off the tube, and just then a fist comes flying out of the bed and just barely skims my face. And I was like, what? And I hear this voice go, "Hey!" And this girl had come out of a coma. I had literally pulled her out of the abyss of death. She wakes up, and there's some guy standing at her head, drilling a hole through her skull. And she's just like, "Get this guy off me." So she tries to punch me. Anyway, I was able to hold on to the tube, luckily, and she did great. I replaced her shunt. She said, "I'm sorry for trying to punch you, doctor." And I said, "Don't worry about it." Anyway, I tell stories like this all the time, but I connect it with ways that we can learn about our health and wellness. I do it on my podcast called the Dr. Kumar Discovery. You should definitely check me out, and I hope to see you there. Cheers.